Welcome to Eugene Cannabis TV. We've got a real special guest tonight, and we always love having guests come in because I know everybody gets tired of seeing me talking and rattling on about stuff. So we have Andy
Nonnenmacher.
Nonnenmacher. I'm going to mess that up. Sorry, Andy, but Andy is one of the bright people we have here locally. It's in the cannabis fight, and we're really lucky to have him. So, and he's well, it's like an old Bill Cosby routine where he was a kid waiting for surgery and had his tonsils out, you know, and the orderly goes by with the food, you know, and he says, "Hey, you, almost a doctor," you know. I'll never forget that. Well, anyway, Andy is, "Hey, you, almost an attorney."
Yes.
So that's an alone. I mean, even where he's gotten to now is quite an accomplishment. So that's really cool. So anyway, so Andy, tell us. Oh, in fact, I guess I should tell people the whole point of your being here. We're talking about the Compassion Center. How many years has Compassion Center been doing this?
15 plus years.
Okay. 15 years, and in the same location too, I think.
It's moved a couple times. We've been here for
I couldn't remember, but
a while.
Yeah. Anyway, they're been doing it clinic and helping people get cards for a long time. But Andy is still the chairman. I mean,
executive director.
Executive director. Thank you. Okay, so anyway, so tell us, how did you, well, let's see, as I established, you've gone through law school, so, but how did you get into the cannabis thing, and how you ended up where you're at now?
All right, thanks for having me on, Dan. I went through law school. I applied for this job last year. I've been in the marijuana movement for several years, and I thought, hey, this is just a really good job to have right out of law school. It'll be helping patients, and so I took the job. I've been there over a year. I absolutely love it. I feel fulfilled every day. I'm doing something that helps out patients. So that's how I got involved in this job. Excellent.
Yeah, and a Compassion Center. I talk about Compassion Center, and people say, "Oh yeah, I know it back when it started. Lotto started it, you know." And I said, "Well, actually, Compassion Center goes back even further than that. Compassion Center actually evolved from Dan Bow, and his partner then Sharon's, and on Wednesday nights we had meetings to where people could exchange medicine. That was the main thing, was helping people receive and anyway exchange medicine. So, but anyway, so that's great. And so tell us all about Compassion Center. You've got now, first of all, the thing that you're nonprofit.
Right, yeah, we are one of the only nonprofit medical marijuana clinics in Oregon. We're the only one in Lane County. Our mission statement, we're dedicated to assisting medical marijuana patients through clinics, support services, and education. And I would really say education is really the linchpin of our organization, and it's what we really are passionate about, is educating patients on how to use medicine, how it interacts with the body. So
classes on growing?
Yeah, okay.
The whole process?
Right, so we have several classes. We have a medicine preparation class. We teach people how to make tinctures, pills, edibles. That's a really, really popular class. It's held about once a month. We also have classes on growing your own medicine. So if you want to learn how to grow your own medicine, you can. And then we have a networking class where patients can meet growers and growers can meet patients. So those are our main classes that we have.
That's great, and nonprofit, so you know, which is really cool. And the thing is, a network. I've been working with medical marijuana patients for a long time, and it's always frustrating that there aren't more patients taking advantage of what's out there, because there's a lot of good stuff out there. It's like Oregon Green Free is another nonprofit organization, and they have an incredible forum, but it seems like there's hardly anybody on them anymore, and I don't know why. I don't understand it, because networking, what it's all about.
Right.
When they would have their monthly meetings, they would try to have a class at every meeting, and they'd have I remember you talking about tinctures. We had a lady one time that showed how to make tinctures. She did the whole thing right there, you know. And I mean, of course, she used what is it? Oh, I keep wanting to say glycerin. I know it's not glycerin. It's
I don't know.
I'll think of it. But anyway, so she had it, was already ready to go because it had been sitting for 3 months, you know. But she showed how you strain it, and then gave everybody a really generous sample too, take home, you know. But anyway, yeah, it's really great for education.
Right, and to that point, I think outreach is really key in terms of people taking more advantages of that situation. We try to do outreach. We try to see if support groups want us to come talk. We just spoke at a chronic pain support group. So if anyone knows of any support groups that would like education on marijuana and the positives and negatives of using it, you can contact Compassion Center.
You're right. Hospice groups too, I would think.
Yeah.
You had any experience with them?
You know, we've tried reaching out to them, and we would love to go speak to the hospice community, 100%.
Yeah, definitely. People should have everything that's available to them. I had a friend of mine whose mother died a very, very painful death, and she would refuse to. This is before the medical marijuana law, shortly before it. But she refused, and her son was trying to get her to try it, and she refused because it was illegal. And she's laying there dying in pain, but wouldn't do it because it was illegal.
Right, it really is sad. It's going to stay that way until marijuana.
Yeah, we have a long history of negativity that we got to get turned around.
Right.
To me, it reminds me of like a big truck, you know, and you need a lot of room. And give me 40 acres, and I'll turn this thing around, you know. Well, we're turning and trying to get her to turn, but it's pretty stiff. It's not real flexible. But so yeah, and you can see by the footage that we've got some. I say we, but the Compassion Center has a great facility there, complete with a boardroom and doctor's room and all kinds of stuff. It's just great. So you've got a little store for selling different products and items. And
exactly. We try to have a professional place that's really discreet and that really makes you feel comfortable walking in. And the other thing I would like to emphasize about our clinic in particular is we treat it like a doctor exam. You're not in and out in 5 minutes. You spend 20 full minutes with the doctor. So we're really focused on patient-centered care and education.
Years ago, I was helping out at the working with Voter Power, and they had their building over on River Avenue.
Yeah.
And I remember one time we had an event there, and we were told, don't use the doctor's office for a smoke room, because the doctor. And I said, well,
bad idea.
Okay. Yeah, and I said, well, yeah, I understand that. And I said, well, other than making it, you know, messing it up, what was the problem? And she said, oh, well, the doctor doesn't like marijuana.
Right.
And I thought, and that cracked me up. I'm thinking, this doctor's making some good dinero reviewing medical marijuana patient cards, you know, but yet she doesn't like marijuana, but she should take that money. I love that, you know, wow. But anyway, and then medicine. Does anybody donate medicine that you can help patients get or do you not do that at all, or what?
We've started to phase that down as dispensaries that have popped up, but we do a lot of networking in terms of patient and grower meetup and helping people really obtain medicine if they're having a hard time obtaining it, because it can be really, really difficult for people in some situations. And there's a law out right now that you have to wait 30 days from the day that your doctor signs your card to actually go into a dispensary. So it's really crucial that people find a way to obtain medicine within that 30-day window.
Yeah, I can imagine. I can only imagine. Yeah, all the hoops you have to go through, you know, and I mean, of course, I'm glad we have the program, but it always kind of irks me because patients are having to pay X amount of dollars a year to be able to use it, you know, and what other medicine do people have to pay to use? I can't think of any, so it's really unjust. It
really is, especially when you consider that cannabis patients don't have insurance. You know, they can't fall back on insurance to pay for their medicine, so that's all coming out of pocket. You know, you have to pay for a doctor exam, and then the filing fee to the state is around $175 to $200.
Yeah, that's a horrible amount of money because they're making a profit, a big profit, and they're profiting off of sick people. And what's wrong with that picture, you know? And yet, I don't know, I always surprised that there's not more outcry, even from our community, about that. We ought to be banging on the doors up there, you know. But
yeah, Dan, I completely agree with that. Yeah, it's a lot of money. I think that they've made $9 million over the past 2 years,
yeah.
and they could cut the fee in half from $200 to $100, and they'd still be a self-sufficient place. So it really is making a lot of money for the state, and it's on the backs of patients.
Yeah, and of course some of our leaders are turn it for a good thing, which is, I mean, that's good to put positive on a negative thing, but then they're saying, well, the program is so successful, it's helping out the budget, you know. Well, whoopie-ding, but it's on the backs of patients, so I didn't, you know.
Right.
That still is not right, but, so you probably see some real hardship cases coming in too yourself, huh, through the clinic?
Oh, yeah, you see a little bit of everything, and you really, you get empathy in this job for other people.
Mm-hmm.
You know, children with seizure disorders where marijuana is the only option for them. You know, people with cancer-related pain and nausea, the marijuana helps. Mm-hmm. You know, multiple sclerosis. There's even evidence that it can maybe hinder the effects of multiple sclerosis. Mm-hmm. So yeah, I definitely agree. You have a lot of empathy in that job for people.
Oh yeah, that's wow. Well, I know that's like my phone number is in the National Normal website for our local chapter, and I get calls, and some of it's interesting because it's people that never thought they'd ever have anything to do with marijuana in their lives, and now they come out with a malady and they find out that marijuana helped and they tried it, and now they're advocates, you know.
Yeah. Or
some of them aren't quite there, but they're real nervous because it used to be illegal, but now it's legal, but now it's kind of like pseudo-legal.
Right, exactly.
And so they're a little uncomfortable, you know, so we had to try to get around that. Many years ago, we had a friend of ours that bought some of those lays, you know, those leaf lays.
Yeah.
She bought a gross of them, you know, and 144, and we were going to sell them to make some money, you know. And we were talking about what are we going to price them, you know, and she said, at cost. She didn't care about making money. She wanted to get them out there. She says, I want to get them out there in the public where people are used to seeing a pot leaf, so they'll say, oh, yeah, it's a pot leaf, instead of, oh, my God, it's a pot leaf, you know.
Right.
And there's some good books on that, too. It's Only a Plant. They heard of that book?
I have not, no.
Yeah, it's a children's book about marijuana, and it's called It's Only a Plant. So
okay.
Anyway, well, that's great. Anything last pointers or things that we forgot to talk about here?
Just really quick. There's a lot of really important bills right now up before the legislature. I'll just mention a few right now. Please write your legislators. House Bill 2821 is a really great bill for patients. It expands the definition of a qualifying condition under Oregon law to include autism. It gives lifetime cards to folks with lifetime conditions, so they don't have to pay the renewal fee every year. And you can designate hospice, palliative, or home health care professionals as your primary caregiver. And probably most importantly, it prohibits physicians from refusing prescription medication on basis of medical marijuana use, which is really important for patients to be able to continue using medication in conjunction with marijuana. So that's all I got.
Excellent. Well, we're going to be right back, and stay tuned. Here we go.
If you're an adult who enjoys a good beer, there's a similar product you might want to know about. One without all the calories and serious health problems. Less toxic so it doesn't cause hangovers or overdose deaths, and it's not linked to violence or reckless behavior. Marijuana. Less harmful than alcohol, and time to treat it that way. For more information, visit marijuanaissafer.org.
Welcome back, and we got Andy with us for a little bit more time because we just was talking about the legislature and what they're trying to do to our laws. So go ahead, Andy, and tell us about what we were just. In fact, let's delve into those a little bit more, those bills that are coming up.
All right, so to start off with, we already went over House Bill 2821, but House Bill 2636,
okay.
Dan.
Yeah.
It would limit the number of cards a physician could sign for medical marijuana cards to 450
bad one. That's
a year.
A bad law. That's a stupid law.
Yes. It would basically shut down medical marijuana clinics as we know it.
And my friend of mine, Jim, anyway, yeah, we tried to do all be good speaking to Senator Lively, and he seemed reasonable, but it's still there.
It's still there, yeah. And basically, doctors are mostly prohibited from signing medical marijuana cards, basically due to internal policies prohibiting them. So it would really cut off access to thousands of medical patients.
Yeah, the problem, they're complaining because there's only so many doctors who have signed a whole bunch of cards. Well, that's because there's a shortage of doctors. That's what that shows. It's not, it's not any kind of a scam or anything. It's like, I remember a while back, quite a while ago, there was a reporter that was going to do an article about how easy it was to get a medical marijuana card.
Right.
He couldn't do it. He couldn't get it. He couldn't do the article because he couldn't get the card because the system works, in spite of the lies, that the law enforcement are the leaders in spreading. I'm sorry, go ahead. I'm off my
That's it. That's all I got on that one.
Okay. And then, and then there's also, what was it, 844, I think it is the one that they're having, I can't remember for sure, but anyway.
Oh, yeah.
There's some other bad ones up there, and so again, if you want some good information on that, the worst case scenario, send me an email at dankbagman@hotmail.com, and I will definitely send you some info on what's going on and where we're at. Our people are the common thing is that we may not know until October what our actual law is going to end up with. Where we're going.
That's exactly right. There are probably 20+ bills on marijuana regulation right now in the legislature, so things are really changing. Yeah,
so they got some bad bills out there, but at the same time, some of the people that we thought were definitely not our friends are actually bending some. So it's amazing, and some of them have R's behind their names too.
Right.
In fact, I was going to do an article about Senator Ferrari. Ferrari is talking about letting dispensaries sell recreational medical. What do you think about that, by the way? We got a few minutes. What's your opinion on that?
I have sort of mixed feelings about it. I can think of why they want to do that. It's going to be legal in July. Mm-hmm. You might as well have a way for people to obtain it, and it could really help out medical dispensaries. And medical growers. At the same time, I'm concerned about adding all those people to the marketplace, and then suddenly there's going to be a huge surge in prices for medical patients. I see that as potentially being happening. Mm-hmm. So it's a mixed bill. I think it's really interesting. I think legislators are just experimenting with the laws right now, mm-hmm. trying to figure out the best way to go.
Yeah. Well, it's interesting. Even after Washington and Colorado legalized and we didn't make it, one of the first thoughts I was is, well, okay, we've got two completely different systems, so now we're going to have a chance to see how they work, and maybe we can get it right by getting the best of the two, knowing which way not to go. So we'll see how it goes.
Before we go, I just want to mention Compassion Center, our address, our contact information. We're at 2055 West 12th Avenue. Mm-hmm. You can email us, execdir@compassioncenter.net, or you can call us, 541-484-0891. If you're interested in volunteering, we lobby a lot with the legislature, and we do a lot of interaction with patients in classes. So if you're interested in volunteering, we'd love to have you on.
You bet. So that's one block off of West 11th, south of West 11th and Garfield. So
exactly.
Just basically think 10th and Garfield.
Right.
Is basically where the clinic is at, and that's of course I just said that.
2055 West 12th. Yeah, the cross street's Garfield.
Yeah. So anyway, that's where it is, and stop in and check them out and say hi. And so we're going to be out of here, and I'll be right back. So here we go. Thank you. Welcome back to another segment of episode 571. That's show number 571, and we've got our friend Sean with us. He's still in town, and got some comments about different things, and has been to Cush once again. And we have the address. Last show we couldn't remember what the address was exactly. We have it today. That's 1325 Red Road Avenue, and it's a good place to stop in and say hi.
Say hi to Josh and all the people out there.
You bet. So supporters, real supporters. So we got an interesting story. It was on KEZI on April 12th. And Sean's going to read that for us.
Yeah, it was marijuana candy brought to school, and it was by Megan Higgins. April 12, 2015. In Eugene, Oregon, a Eugene 8th grader is accused of bringing marijuana candy to school and passing it out to other students. Police said it happened on Tuesday at James Monroe Middle School. In an email sent to parents Thursday evening, Principal Michael Johnson said an 8th grader brought edible marijuana and gave it to several friends to eat. Police said the student got the 12 marijuana candies from home. The school confirmed the students involved knew what they were eating. Now, Principal Johnson said while the situation is rare, it is eye-opening and a good opportunity for families to talk about cannabis and drug use, so that they're prepared to react when the situations present itself, whether it's at the school or somewhere else in the community, said Johnson. A school resource officer is now handling the case. Meantime, police have met with the 8th grader and their parents. So far, no charges have been filed. Due to lack of evidence, either the drugs were consumed or thrown away. Now, people, this brings up another subject about these Girl Scouts being in front of dispensaries and collectives, because there's children there, and in some states, collectives and dispensaries aren't allowed around schools, daycare centers because of the children. So how do we know that this girl at home didn't think that those candies were like Girl Scout cookies or something? Because there are medibles in those dispensaries that are initial Girl Scout cookies. Okay, we have a plant like that, we have edibles like that. So be alert and try to keep those Girl Scouts away from those dispensaries, because it gives everybody a bad name and it's a catch-22 for the government to come in on everybody. All right, so stay safe, stay strong, and stay well.
You bet. And we have another interesting story, a couple of them on the same subject. This is in the Willamette Weekly, dated the 7th of April, by Aaron Mesh. The lawmakers may let medical marijuana dispensaries sell recreational weed starting July 1st. The Oregon legislature is mulling a plan to let medical marijuana dispensaries temporarily sell pot to all adults as soon as recreational weed becomes legal July 1st. The idea by Senator Ted Farrelly, Republican John Day, could solve the problem of where to buy recreational weed while the Oregon Liquor Control Commission licenses recreational growers and stores. OLCC Chairman Rob Partridge has said the licensing process probably won't be finished until late 2016, more than a year after recreational weed is legal to possess. Farrelly's proposal was first reported this afternoon by the EO Media Group, Pamplin Media Group Capital Bureau. Senator Jenny Burdick, Democrat, Portland, who chairs the House Senate Committee on Legal Weed, tells Willamette Weekly she likes the Farrelly's plan. I don't know that we can pull this off, Burdick says, but I think the concept is a good one. It might allow people to get marijuana without going through other channels that might be illegal. So that's a good point, and because if it becomes legal and it's not available, people are going to go to the black market to get it, and the black market's going to really go.
Now, I've been watching my posts in my secret group, and so far I've seen that Costco is going to have commercial cannabis, and Marlboro has come up with a cigarette. So really, I don't see why patients would have to give up their collectives and dispensaries to the general public when it becomes recreational, when it will probably be allowed out there in other places for the common public.
Mm-hmm.
So I don't believe that our private rights between doctor and patient and our medical use should be volunteered to the public like that.
Yeah, I don't know. It's we don't know. Yeah, it's hard telling what we're going with this. It's wild.
Well, I'm just giving thought for the cameras
Right.
and the voters to think about.
Definitely. Oh yeah, definitely. And real quick, the last story we have is from hemp.org. It's written by Steve Elliott, dated on April 8th. Major marijuana campaign hires a lobbyist to pass the expungement law. New Approach Oregon has hired a lobbyist to help pass bills in the Oregon legislature that would reduce marijuana offenders' jail sentences and clear marijuana-related offenses from criminal records. The group behind Oregon's law to legalize marijuana is also teaming up with the Bus Project to organize volunteers, host phone banks, and win endorsements for House Bill 3372 and Senate Bill 364. Both bills await hearings in the House Judiciary Committee. Senate Bill 364 has already passed the Senate. We built a powerful organization to legalize marijuana, said Anthony Johnson, Executive Director of New Approach Oregon, and we plan to use it to make sure bills are passed. Let's stop ruining lives by treating marijuana as a crime and start saving money by getting people out of jail and giving them a fresh start. Click here to see. You can help by Oregon was one of the highest marijuana possession arrests in the country, according to the Oregonian, which about 1 out of every 14 arrests are marijuana. These arrests are also racially biased. Even though they use marijuana at the same rate as white people, African Americans in Oregon are more than twice as likely to be arrested for it, according to research by the ACLU. Measure 91, which legalized marijuana in Oregon, passed in November by a 12-point margin. Rulemaking for the Oregon's new marijuana law is currently underway. Marijuana possession and home cultivation by adults 21 and older becomes legal on July 1st. So anyway, we all know that. So, oh yes, prosecutors in counties like Multnomah, which include Portland, have stopped enforcing obsolete marijuana laws. So it's like I say, the walls are coming down and the cat's out of the bag. The cat's out of the bag and it's not going back in.
Yeah, it's like my stop at Alton Baker Park when the Eugene police gave me a citation just for having a bong, but since I was so cooperative, that's how I got the citation. He did the finger, me watching it with my eyes and not moving my head. He took notes and we talked for a few minutes, and then he just told me if I started my car again, somebody would call and he'd come out and tell me because he didn't want me on the road under the influence. So you know the story usually, but some people do get to walk away with it.
Yeah, so it was a decent confrontation, so just don't have them. Anyway, we'll talk to you later and come back next week and we'll be here. Thank you.